that anyone over the age of 74 has to go before what is effectively a death panel. Yes, they do. Yes, they do. It's in there, folks.
There are no such death panels, obviously, in any of the bills that are being considered.
When he says that's just what's behind a government-funded effort to come up with 12 specific issues physicians should consider when figuring care for elderly patients. Bottom line, if they don't have a whole lot of years left, is it worth providing them costly medical procedures now? Doctor, if you're right, that is a death panel.
Well, you're looking at it. I'm the death panel. This is what the government wants. This is what the government wants me to do. For 4 years, risk factors of longevity, and then now it has turned into this new test to allow doctors to tell patients, look, you maybe not need, maybe you don't need that kind of screening. Maybe you don't need this kind of treatment for diabetes. You have, you're in your 80s right now. Maybe you should stop. And this is, the ethical fact that they're even proposing this is mind-blowing to me. And we wrote about it yesterday, complaining, and the response, by the way, that we got from a lot of people was amazing. This is, you don't go into healthcare, looking to decide who lives, who dies, what tests.
Charlie was born on the 4th of August last year, so he is now 10 months old. He had all the appearance of a normal baby at birth, but he has a rare inherited disease, infantile onset encephalomyopathic mitochondrial DNA depletion syndrome, otherwise known as MDDS. This means that his condition has deteriorated seriously since he was born. He cannot move his arms or legs or breathe unaided. His brain is also severely affected, and there was a significant decline in the level of his brain functioning in January this year. He is kept alive by a mechanical ventilator. His parents agree that his present quality of life is not worth living, but they have been offered the prospect of a new treatment in the USA, deoxynucleoside therapy, which it is thought might result in some amelioration of his condition. In short, therefore, it is quite clear that the hospital was entitled to bring these proceedings. The judge was required to determine the outcome of these proceedings. In doing so, he applied the right test, and his factual findings cannot be challenged on an appeal. It follows that the proposed appeal does not raise an arguable point of law of general public importance, and so permission to appeal must be refused.
Holding Charlie in her arms. But time is running out. His life support could be switched off by the end of tomorrow.
Obviously we've got this date looming up where they want to turn the machines off. So
at the moment we've got till midnight on Wednesday.
And how does that feel as parents, that there is a clock ticking?
It's absolutely terrifying.
The parents of Charlie Gard have been involved in a court battle to save their son. Last week they lost an appeal to keep his life support switched on.
One of the hardest things for me was when we actually got the appeal papers. It says Connie Yates and Chris Gard versus Great Ormond Street Hospital and Charlie Gard. And that broke my heart because we're not his mum and dad anymore. They've got parental responsibility. And how is that right? Basically it seems as if you take your child into hospital, you no longer have any responsibility for them. They take over.
Thinking of my constituents. If there is any room for discretion within the court rulings for Great Ormond Street to allow Charlie to leave and to transfer his care to doctors at Columbia University, and he is sufficiently stable to receive treatment, would the Prime Minister do all she can to bring the appropriate people together to try and make this happen?
Can I first of all say to the Honourable Lady that she is right to raise the concerns of her constituent in relation to this particular matter, and I'm sure the thoughts of all members of the House are with the family and Charlie at this exceptionally difficult time. It's an unimaginable position for anybody to be in, and I fully understand and appreciate that any parent in these circumstances will want to do everything possible to and explore every option for their seriously ill child. But I also know that no doctor ever wants to be placed in the terrible position where they have to make such heartbreaking decisions. The Honourable Lady referred to the fact that we have that court process here. I'm confident that Great Ormond Street Hospital have and always will consider any offers or new information that has come forward with consideration of the well-being of a desperately ill child.
Guard's parents called their son an absolute warrior at London's High Court today, but they said time had run out for him after new medical tests showed irreversible brain damage. Charlie was diagnosed with a rare genetic disease that left him blind, deaf, and unable to move or breathe on his own. Doctors treating him in London said Charlie could not be cured and went to court to argue he should be taken off of life support. His parents fought back and asked to take the baby to the U.S. for an experimental treatment. But after 5 months of bitter legal wrangling, the U.S. doctor agreed with the London hospital. There was no hope. For Charlie's father, it was difficult to accept.
A whole lot of time has been wasted. We are now in July, and our poor boy has been left to just lie in hospital for months without any treatment whilst lengthy court battles have been fought. We can't even take our own son home to die. We've been denied that. Do you not think we've been through enough?
Our final wish.
In the end, a High Court judge said he should be moved to a hospice and his life support withdrawn soon afterwards.
Hello.
Charlie Gard never made his first birthday, but in his short lifetime, he impacted the worlds of medicine, ethics, and law.
Does what the president is going to do through regulation in terms of end-of-life counseling have anything to do with death panels? Just to shed light on what has become an unfortunate, in my view, a terribly unfortunate phrase to capture a critically important issue?
Well, I agree. It is incredibly unfortunate. It became the poster child, I think, of the opposition's attempts to kill the health care bill. All we're talking about here is providing funding for physicians to have a discussion with their patients on options at the end of life. It's empowering patients.
What? Bro, what are you talking about, man?